Good, good. What's next? So it's not working. Are the injections next? If so, what's your approach with that? I can't tell you the amount of guys. Once again, I don't prescribe any of these things, but they're my patient, they're somebody else's patient, and they're either emailing me, yeah, I'm in the ER with priapism. So, which is an erection that doesn't go down within, I don't know, 2 to 3 hours or so. And that's a visit to the ER. So are the injections next, and how does it work?
So those patients, we tell them, be careful what you wish for, right? Because we don't want them to have too much of an erection. So it's the same principle that we typically
a problem that most guys wish they had until they have it.
Yep,
and then they're like, wow, this is the worst. This is actually painful. And then they're like, yeah, I don't want this ever again. Yeah, right.
So it's exactly the same. So we go ahead and do the same approach that we actually do with the oral medications. I will tell them from the get-go, hey, the first thing we have to start you on the lowest dose, and it may be just don't get disheartened because it may take a couple of trials before we actually find the actual dosage that's right for you. But we cannot overdo it, because then we can get that prolonged erection, which can then cause a bunch of other problems, not even necessarily the pain, but all the sequela that it can actually cause. So the same thing is, we start them on low, we bring them to the office, we take a look we do a sonogram or penile Doppler, see what the main problem is, we teach them how to do the injections, we see the response that they have when we do the ultrasound at the clinic, and then from there we go and we teach them how to slowly start titrating the dosage of the medication so that they can get the best results, a good erection, a firm, rigid erection that's enough for sexual penetration, that after they complete the sexual activity, then it goes down. Because what we don't want is for them, like you were saying, to have that prolonged erection after finishing sexual activity, which does not go down, and then now what do we do?